Hello, my name is Ashlyn Carey, and I am from Wright State School of Professional Psychology, and today I will be presenting my non-empirical research on trauma in incarcerated women and how it affects reentry. Throughout my PowerPoint, you will see a QR code in the bottom right corner to access this PowerPoint, as well as QR codes on the last slides to access my full research. Within the United States, there has been a significant increase in the number of incarcerated women in recent decades. Approximately over 800,000 are currently on probation or parole. Correctional facilities are often the last resort for psychiatric treatment for women with PTSD due to this population often being low SES and very vulnerable. Harner et al. Stated that it is imperative that correctional facilities provide evidence-based trauma treatment to better the lives of these women suffering from trauma. Their research addressed the unique needs of incarcerated women with trauma and stated key problems that can result from not attending to them. This includes, but is not limited to, physical health problems such as sleep problems, chest pain, shortness of breath, as well as increased comorbid mental health concerns. Historically, research has addressed men's needs within the criminal justice system. Disproportionately, women have received less attention in this domain. Many of the programs in place may not be adequate for women processing reentry. Some instruments, such as risk assessments, were designed and developed based off of male offenders with little attention to gender-specific concerns. The shortage of implementation of gender-responsive risk assessments can make it more difficult for women to receive responsive case management while on probation or parole because their supervisors are uninformed. Many female individuals come into the correctional system already having experienced trauma throughout their lives. Being incarcerated increases the risk of unknown trauma symptoms occurring due to unbeknownst triggers that the individual may have. Being incarcerated is traumatic in itself, and often individuals accumulate more trauma while serving their sentence. While incarcerated, there are high rates of individuals developing comorbid symptoms along with trauma, including suicidal behavior, self-harm, and aggressive behavior. It is crucial to prioritize the treatment of women with trauma and PTSD as they exhibit distinctive characteristics compared to their male counterparts. Even when exposed to comparable traumatic experiences, such as incarceration, women were more susceptible to developing PTSD than men. While incarcerated, women face environmental stressors that can amplify trauma, such as having a chaotic environment and a controlling environment and having that power differential. This controlling behavior can mimic abusive behavior that they have dealt with prior to imprisonment. Additionally, uncertainty and related to unclear rules within the correctional facility can cause increased anxiety for individuals who are well versed in behaving in the right way to avoid a threat or punishment within their childhood or in their abusive relationships. The types of services many individuals receive before and after they leave incarceration and return home are not designed to address experiences of trauma and loss. Trauma can affect areas of employment and work trajectory, coping strategies, interpersonal relationships, and social engagement. Deficits in all of these factors can lead to increased risk for reoffending. A point I want to enforce is that trauma-informed reentry programs can help reduce recidivism rates and improve the overall well-being of these incarcerated women and their families. Reentry programs should be trauma-informed, thus meaning that they should prioritize the safety and the well-being of individuals with trauma histories. Appropriate staff should be trained to recognize and respond to trauma symptoms and triggers, creating a supportive and healing environment. Reentry programs should focus on building resilience and providing opportunities for women to develop healthy coping mechanisms and build positive relationships within their community. That concludes my presentation for today. Thank you for tuning in. And again, please use the QR codes for additional information.